Hello, welcome to Today in Social Media. I'm Victoria Delgado from the Netherlands, and it's my privilege to be with you all and with a distinguished panel, role models to follow in social media with excellent tweets. And you know that we are going to discuss today, or we are going just to highlight what has been in social media so far. We have with us Professor Roxana Mehran from New York, Dr. Gerhard Hendricks from Leipzig, and Pascal Meier from UK joining us. Pascal, how are you? I know that you
Hello,
are
very
one
well,
of
thanks.
I know that you are one
Hello.
of the ambassadors for us and ESC doing excellent job. What has attracted for you most from social media so far about the ESC Congress?
So for me, it has been striking the activity on social media this year. I mean, it has been in recent years there has been a growth of social media activity, but this year is really incredible. There's so many active tweeters. There's 3,400 active tweeters that really discuss trials, that put out data, and it's very interactive. There's a few more thousand passive tweeters that read these tweets. Overall, there have been almost 12,000 tweets so far, and it's only day 3. And overall, these tweets have been read over 85 million times. So the impact of this social media activity is huge. And I really want to thank all these ambassadors that are so actively tweeting and discussing and interacting with the people out there. And I think it's a good example also of the interactivity, the increasing interactivity between different fields. So it's not just cardiologists, it's different subspecialties, it's nurses, allied health professionals, and renal doctors, diabetes specialists, and I think that's one of the really added benefits of this Congress and social media.
Exactly. Good that you highlight this topic because we have an excellent job from all the ambassadors and all the people. We get a really good exposure. And now that you said that is much more cross specialities, including nephrologists, for example, or other specialties. Yesterday, one of the studies that was highlighted in the hotlines was Fidelity and Figaro's DKD. What do you think about those? What is your take-home message of those hotlines, if you can make it in one tweet, for example?
So I would say it's important that we stay open-minded and don't just focus on kind of traditional cardiac medications. But this trial was about diabetes, kidney dysfunction, but the outcome was on cardiovascular event reduction. So it was an impressive cardiovascular event reduction, which is important for us cardiologists. So these patients need to be also seen by us and treated by us in a multidisciplinary way. And I think this trial is a very good example that we have to kind of work closely together with different specialities.
I mean, I thought it was an amazing trial. If you think about it, it was kind of bringing, again, kind of the thematic approach of the teamwork in caring for the patients, the cardiorenal connection that we've often talked about, and, looking at patients with CKD and diabetes and showing that these patients could have an important impact, we can have an important impact on their cardiovascular outcomes. What did they die of? What did they have? What was the big issue? And was it mostly heart failure, let's say, or HFpEF, or whatever it was in this population, because the LV ejection fraction was about 40%. Exactly. It was a very, very interesting study. And then bringing those two studies together in Fidelity, showing even a bigger outcome for finerenone. I mean, really interesting.
Exactly. These were very much discussed. And also what you say about, for example, now the different ejection fractions in heart failure patients that doesn't seem to matter much. Yeah. And all this. This was also, for example, a little bit highlighted in the valvular heart disease guidelines that were yes. presented yesterday. What is your take-home message?
It was another
Roxana?
Sort of the thematic approach of team sport that we're playing here in caring for our patients, bringing subspecialties. It was a surgical and a cardiology guideline, the European Association of Cardiothoracic Surgeons, as well as ESC, coming together in these guidelines. So congratulations, you're on the guidelines. You did a beautiful job. And I think it was beautiful to show that this is a team effort to take care of these patients, not just from surgeons and cardiologists, but also within cardiology, multiple subspecialists like electrophysiologists, imaging, heart failure specialists, everyone coming together for the care of the patient in this shared decision-making. The algorithms were beautiful. I was amazed to see that it looks like, first of all, congratulations, but really important that you guys brought the tricuspid valve is no longer forgotten. It's not the forgotten valve, and I love that you brought it in. And then the whole focus on the asymptomatic population, the time to treatment, and are we underdiagnosing? Is there more than meets the eye now? And should we be doing a better job in diagnosing valvular heart disease? What do you think? I mean, is that...
Yes, indeed.
Was that the theme, or did I miss it?
No, I think that you captured excellently. And indeed, I think that it's very important to educate everyone, patients, physicians, increase the awareness of valvular heart disease problem, because it's an important burden. And imaging there plays an important role. For the asymptomatic ones, we always need to weigh the risk of the intervention, but also not to be too late, so that we can get the best benefit from the intervention or the treatment. And their imaging, has been a lot of social media moving away maybe from left ventricular ejection fraction and go to other markers like longitudinal strain or cardiomagnetic resonance, for example, that you can see a little bit more. And I think that that is one of the fields that we need maybe more research in the future.
But I also got the feel that I think we have to do more education for our general practitioners who are the ones who put the stethoscope on the chest of the patient. And when they hear a murmur, or if they get an echo and there is valvular heart disease, to refer earlier rather than waiting until, so that we could really do all that needs to be done. I thought all of that was very well covered.
Yeah, indeed. I think that the studies yesterday were also trying to put more focus on early treatment. And I think that one of those studies was the CAF2, where there were important insights or also messages to move forward the field. How do you think? What do you think?
Absolutely, Vittoria. DCAF2 induced a huge wave in the social media, and it's really amazing and impressive to see the speed of distribution of knowledge using social media. I mean, DCAF2 was a trial that randomized 800 patients undergoing catheter ablation of atrial fibrillation for an MRI-based substrate modification approach versus pulmonary vein isolation, the traditional approach. And there are two key messages from DCAF. One is that there was no benefit with respect to rhythm outcome with the extended MRI-based ablation strategy. It's important to know because it tells what we should not continue to do. On the other hand, there is significant new information that has been gained by DCAF. There is no other trial on the planet so far that has such a strong set of data from MRI pre-procedure, from MRI post-procedure with lesion visualization, comparison of MRI data with voltage maps and outcome data. So we will learn a lot from DCAF, and I think DCAF will push the ablation strategy in the future significantly forward.
That's great. So in order to summarize a little bit all this social media, if I ask you what would be the tweet for today for you, Gerhard, what would you say?
I think the most important tweet that I've seen in the last 24 hours was the one on DCAF saying that the results of DCAF are not disappointing. There is no disappointment in science because we measure and then we take it forward to the future.
That's a great message.
We learn from negative studies, don't
Absolutely.
we? And I think that's great. And, you know, MasterDAPT was another one that on high bleeding risk patients, abbreviated versus prolonged, another really, really great game changer. That was a good tweet too on MasterDAPT.
Great. And for you, Pascal? What would be your tweet? We cannot hear you now. You are muted. I think that is all the things that we have in social media.
That's right,
and
it's good.
on Zoom. So if you can unmute.
Sorry.
Oh, he's back.
The,
Great.
So for me, the most important tweet was as has already been said, also on these negative trials, like the envisaged TAVI-AF trial, which showed that edoxaban didn't improve outcomes, was non-inferior, but with somewhat more GI bleeding. But still, I think it's also, these trials are very important, and it's good that they are discussed on social media, on site, and in our community.
Great. So this has been a great session, and I think that highlights the importance of having all our ambassadors, all the audience tweeting and retweeting, checking on social media, also on Facebook or LinkedIn or all the platforms that you want, what is happening in ESC. Stay tuned, because today there are many more hotlines, new guidelines as well on pacing. And today there will be a live event on Facebook at 9 o'clock in the evening where will be discussed science around the world. I wait you all there. Thank you very much for your attention.